This meta-analysis reviewed 10 randomized control trials of platelet-rich plasma treatment in NeoA and found that if you compare the use of platelet-rich plasma to an injection of hyaluronic acid, you get much better outcomes with the use of platelet-rich plasma. This next article is a randomized control trial that compared hyaluronic acid injections to platelet-rich plasma injections and then looked at the impact of combining both. What they found is that platelet-rich plasma by itself has better outcomes than hyaluronic acid injection by itself, but when you combine PRP with HA, you get a better outcome than using one or the other. This study looks at the use of PRP in tennis elbow and plantar fasciitis in a population that failed traditional therapies with non-steroidal anti-inflammatories and physiotherapy. And what they found is that by far the majority of the clients that received PRP after failing traditional therapies improved quite significantly. And I'd also like to present a brief review of outcomes from Dr. Kristen Oliver, who does a lot of work in the use of PRP in partial rotator cuff tears. And this is what her latest research has found.
I want to just briefly bring up one other data set we have in regards to our SOS outcomes on partial thickness rotator cuff tears using PRP. So these are platelet-rich plasma, partial thickness rotator cuff tears. 50% or less total thickness. It could either be the super, infra, subscap, or a combination thereof. We only have 67 patients in this so far, and we have a total of 34 out a year. But we are finding encouraging data that shows that there's definitely clinical improvement, significant improvement even by 3 months, which is advanced even further by a year. Same thing with our VAS findings. They follow that same tune where you're seeing a big jump in improvement at 3 months and then improving up to a year, and the same with the SANE scores.
And as a point of interest here, at Regenesis Medical Services, we're seeing exactly the same outcomes regarding the use of platelet-rich plasma injections for partial rotator cuff tears.